Walter was 71 years old, and on paper, he was the picture of success. For 3 years, his blood pressure readings were almost perfect, 118/78. His doctor smiled every visit. His wife was proud of him. He took his pills every single morning without fail, exactly as told. And then, one ordinary Tuesday, Walter stood up from his kitchen chair to refill his coffee, and the room tilted sideways. He grabbed the counter, but his legs were already gone. He went down hard against the tile. What sent Walter to the hospital that morning was not high blood pressure. It was the opposite. His body, at 71, simply could not survive on the number a guideline written decades ago told him to chase. If your doctor told you to get your blood pressure down to 120/80, they were not wrong. That number has saved millions of lives. But after 60, chasing it the way you did at 40 can quietly become one of the most dangerous things you do to your own brain. And almost no one explains that to you when they hand you the prescription. I am Dr. Goodman, and I have spent years looking at how the aging body actually responds to blood pressure treatment, not how a textbook says it should. What I am about to walk you through does not come from my opinion. It comes from large clinical trials, peer-reviewed research, and frankly, the things many cardiologists quietly tell their own parents that they never put on a poster in the waiting room. By the end of this video, you will know the warning signs that your target has been set too low for your age, and you will know how to find the number that actually protects you. Stay with me, because the number 5 sign on this list is the one almost everyone blames on simply getting older. And the number 1 sign is the exact thing that put Walter on that kitchen floor. Most people feel it for months and never connect it to the pills in their cabinet. Let me start with the question nobody ever answered for you. Where did 120/80 even come from? For decades, researchers studied huge groups of adults and noticed that people sitting around 120/80 had fewer heart attacks and strokes. So that became the target for everyone. Simple, clean, easy to remember. And for years, nobody pushed back on it. But here is the part they left out. Most of those early studies were built on younger adults, people with flexible arteries, healthy kidneys, sharp memories, and not a single pill bottle on the nightstand. They were not studying a 70-year-old who manages 2 or 3 conditions and already swallows 4 tablets before breakfast. Because after 60, your body changes in ways that completely rewrite the rules. Picture the plumbing in an old house. When the copper pipes are new, they flex a little, and water moves easily at gentle pressure. After 40 years, those same pipes turn rigid and narrow, and the water needs a stronger push just to reach the upstairs faucet. Your arteries do the very same thing. They stiffen with age, and a stiff system needs a slightly higher pressure to push enough blood all the way up to your brain. So when a doctor aggressively forces your numbers down toward 120, your heart obeys, but your brain starts getting shortchanged. That is the precise moment people begin feeling dizzy in the morning, foggy in the afternoon, and unsteady on their feet for no reason they can name. And here is what worries me most. A fall at 40 is a bruise. A fall at 70 is a broken hip, a hospital bed, and sometimes the beginning of the end. A review published in the Journal of the American Geriatric Society in 2019 found that aggressive blood pressure lowering in older adults significantly raises the risk of falls and fall-related injury. Nobody warned Walter about that. And that is exactly why this conversation has to happen. Before we go any further, do me a favor and tell me in the comments where you are watching from and what your last blood pressure reading was. I read these, and it helps me understand who I am talking to. And if what I am telling you is starting to explain something you have felt for a long time, type the word real in the comments so I know to keep making videos like this one. Now let me tell you about the study that quietly changed how many cardiologists think. In 2015, a major trial called SPRINT studied over 9,000 adults, average age 68. They split them into 2 groups. One aimed for a pressure below 120, The other aimed for below 140. The lower group had fewer heart problems. And from that day forward, many doctors started pushing even harder for that low number. But read the fine print of that same study, the part that never makes the headline. Sprint excluded anyone with diabetes. It excluded anyone who had already had a stroke. It excluded people with dementia, advanced kidney disease, and serious frailty. In other words, they studied the healthiest, strongest older adults they could find. And even within that hand-picked group, the lower target caused more dizziness, more fainting, and more dangerous pressure drops when standing. If that carefully protected group struggled, what do you think happens to the average person over 60 watching this right now? So let me count down the 5 warning signs that your blood pressure target has been set too low for your body. We are going from number 5 up to number 1. And number 1 is the one that matters most. Number 5, cramping in your legs and feet, especially at night. Eleanor, 67, kept waking at 2 in the morning with her calves knotting up like a fist. She blamed her mattress. She blamed dehydration. What was actually happening is that some blood pressure medications, particularly the water pills called diuretics, flush potassium and magnesium straight out of your body. Those 2 minerals are what let your muscles relax. Drain them low enough, and your muscles seize. Here is what to do. If you cramp regularly, do not just chew an antacid and roll over. Ask your doctor to check your potassium and magnesium levels with a simple blood test and ask whether your specific medication could be the cause. Sometimes the fix is as small as changing the pill, not adding another one. Number 4. Brain fog that you have quietly started accepting as normal. Frank, 69, used to do the crossword in ink. Then he started losing his train of thought mid-sentence and blamed it on his age. But your brain is the single most demanding organ you own. It is only about 2% of your weight, yet it drinks roughly 20% of your oxygen and a quarter of the sugar in your blood. It needs a steady, generous flow at all times. When your pressure is held too low, that flow thins out, and the first thing to suffer is clear thinking. What to do? Before you accept brain fog as just getting old, track your readings against how your head feels. If the fog is worst in the hours right after your pill, that timing is a clue worth bringing to your doctor. Number 3, and this is the one people are most surprised by, unusual exhaustion that sleep does not fix. Doris, 72, slept 8 hours a night and woke up feeling like she had run a marathon. She was certain something was deeply wrong. What was wrong was simple. Her organs were working overtime because the pressure pushing blood to them was simply too weak. Your kidneys, your muscles, your heart, all of them strain when the supply runs thin, and that strain shows up as a bone-deep tiredness that no nap touches. What to do? Exhaustion plus low readings is not something to push through. It is data. Write down your energy level next to each reading for a week and take that page with you. A week of real life tells your doctor more than one reading in a cold exam room ever could. Number 2, vision or balance that flickers for just a few seconds. George, 70, would occasionally feel the floor go slightly uncertain beneath him, like standing on a boat, and then it would pass. He never mentioned it to anyone. But brief moments where your sight smears, your balance wavers, or you feel like you might tip over, are your brain briefly running short on fuel. And I have to be honest with you here, because these same flickers can also be the warning shots before a stroke, a so-called transient attack. So this is not a sign to wait on. What to do? Any sudden, brief loss of vision, balance, or coordination, even one that vanishes in under a minute, deserves a real conversation with your doctor, and soon, not at your next routine visit a year from now. And number 1, the sign that put Walter on his kitchen floor.
Dizziness when you stand up, especially first thing in the morning.
That rush to the head, that spinning, grab-the-wall moment when you rise from a bed or a chair, has a name. Doctors call it orthostatic hypotension. It means your pressure drops too fast when you change position, and your brain blacks out for just an instant. A study published in the journal Hypertension in 2020 found that this single problem is linked to a 40% higher risk of falls in adults over 65. 40%. This is not a small thing. This is the difference between an independent life and a hospital bed. What to do? If you get dizzy standing up, do not just learn to rise slowly and accept it. That dizziness is your body screaming that your target is too aggressive. It belongs at the very top of the list when you next see your doctor. So if those signs sound familiar, you are probably asking the obvious question. Then what is my number? Here is the framework many cardiologists now use when they sit down with their own family members. It comes down to 3 honest profiles. Find yourself in one of them. Profile 1. You are between 60 and 79. You walk regularly. You are independent. You do not have major conditions like kidney disease or dementia, and you do not get dizzy when you stand. If that is genuinely you, a target below 130/80 is reasonable, and the research supports it. The protection is real, and your risk of side effects is relatively low. Profile 2. You are between 60 and 79, but you manage more than one condition. Maybe diabetes, maybe kidney trouble, maybe you are already on 3 or more medications, and you sometimes feel lightheaded. For you, the 2021 guidelines from the American College of Cardiology suggest a safer range is between 130 and 140. Pushing below 130 in your situation is not more protective. It can cause more harm than good. Profile 3. You are 80 or older. Here, the research is clearest of all. A systolic target between 130 and 150 is considered appropriate, depending entirely on how you feel day to day. If you sit comfortably at 120 with no dizziness and no fog, wonderful. But if you feel even slightly unsteady, your body is telling you it needs more. And that is not failure. That is your physiology being honest with you. Now, I need to be completely straight with you, because you deserve honesty and not just reassurance. Lower blood pressure genuinely does protect some older adults. The SPRINT trial and a later trial called STEP, run in 2021 with over 8,000 adults, both showed real heart benefits at lower targets. That is true, and I will not pretend otherwise. But both trials also showed real costs in everyday patients. More falls, more kidney strain, more dizziness. A paper in JAMA Internal Medicine in 2022 found that in adults over 75, overly aggressive control was linked to more kidney injury and faster cognitive decline over just 2 years. The 2023 guidelines from the European Society of Cardiology now say plainly that targets in adults over 70 should be individualized, not stamped from a single number. The science does not say lower is wrong. It says lower is not automatically right for you. So here is exactly what to do with all of this, because information you do not act on helps no one. 3 steps before your next appointment. Step 1. Decide which of the 3 profiles is honestly you, based on your life today, not the life you had at 55. Write it down. Step 2. For the next 7 days, every time you take a reading, jot down how you feel in that moment. Dizzy, foggy, tired, or fine. That log is gold. Step 3. When you sit with your doctor, ask one precise question. Given my age, my conditions, and these symptoms I have tracked, what is my personal blood pressure target? Not the guideline average, my target. That single question changes the entire conversation, and any good doctor will respect you for asking it. And let me be clear about the other direction too, because I do not want anyone walking away thinking high pressure is safe. It is not. If you ever take a reading where the top number is around 180 or higher, and the bottom is around 110 or higher, that is not just elevated. That is a crisis, and it is a reason to call emergency services. not to wait. And never, ever start or stop a medication on your own based on a video, including this one. The goal here is not to throw away your pills. The goal is to make sure the target behind them actually fits the person you are today. I want to leave you with something real. Getting your number right after 60 is not about a reading on a machine. It is about standing up in the morning without reaching for the wall. It is about a mind that is clear before your first cup of coffee. It is about being steady enough to walk across the room toward a grandchild without that flicker of fear. You have spent your whole life showing up for everyone else. The very least you deserve is a number that was chosen for your life, not borrowed from someone half your age. This video is for your understanding and education, and it is not a substitute for your own doctor, who knows your history. So take what you learned here and turn it into a better conversation at your next visit. If this made something finally make sense, hit that like button. It genuinely helps this reach more people over 60 who need it. Subscribe and ring the bell so the next one finds you. And do not click away yet, because there is one more thing I have to show you. Everything we covered today is about managing your pressure smarter. But there is one common bedtime habit that quietly drives your numbers up overnight while you sleep, and almost no one knows they are doing it. I made a full video on exactly that, and it is waiting for you right on your screen. Watch that next. It might be the most important thing you do for your heart this week.